Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911. Well, hello everyone, and it's another Monday. We made it through the week, and I'm so glad you're here with me on this podcast. And here to take a journey along with me and all of you out there. And we'll see where this podcast goes. I know this episode's going to be kind of crazy when I tell you what the title is, but I felt that during these times when the weather starts to change and goes into winter, a lot of us with neuropathy, fibromyalgia, or any type of a nerve pain has issues with this topic. And it's going to be, the topic is on tips to combat nerve pain in colder weather. Now, before I get going here, I'm going to talk about myself first. And I hate it when it comes to winter. It really is painful. My nerves are in pain because of the cold air. I can't even have anything cold touch them at all. But in my own case, when it starts getting this time during the winter, I have to have a heater also going at the same time. So I have to regulate the temperature just right. Anywhere from 70 to 75 is great for me. I know that sounds crazy, but that's the only way I can get through the night or through the day, is having that temperature just right. And it takes quite a while, takes a bit of time to make sure I get those adjustments down before I even fall asleep. But that's my story, and I'm sticking to it. That's the only way that I can get help. And maybe you guys can let me know some of yours. Post them, right here on a Neuropathy Support Group and Podcast, and I'll take a look at them, and maybe we can talk about them in my next episode. But I've done enough talking here. Let's get going, and let's get on this topic and see where it takes us. So to begin with, here's what neuropathy is. Like most chronic pain, often gets worse as temperatures drop. Blood flow slows in your outer extremities when your body is exposed to cold. Nerve pain, especially in your hands and feet, increases as your circulation decreases. The change in barometric pressure due to temperature drops intensifies pressure on the nerves, which send pain signals to your brain. Your perception of pain is increased as the nerve signals slow down because of the pressure. Also, soft tissues become firmer and tighten in the cold weather, thus resulting in painful muscle spasms. This is why it is important to take precautions as the seasons change. So here's some tips for you. Of course, the obvious is to bundle up. Make sure to wear winter essentials. A sturdy coat, hat, scarf, gloves, and thick socks are helpful when going outside. These items will prevent your body heat from leaving and the cold temperatures from getting to you. Keep your body heated and covered to help blood flow and muscle stiffness. Because your feet and the hands are affected first and most intensely, it's important to layer your socks and keep your hands covered as much as possible. Another tip is to avoid caffeine. It's nice to have a warm drink when it is cold, but try to stay away from caffeinated beverages. Consuming high amounts of caffeine can cause blood vessels to temporarily narrow, restricting the blood flow to your extremities. This could lead to increased nerve pain. Next tip, take an indoor break. Although it's fun to build a snowman or take a walk in the brisk air, avoid staying outside for prolonged periods of time. Take breaks indoors often. This will let the warmth return to your body, blood flow to increase, and muscles to relax. Next tip is to incorporate exercise. Taking part in light cardio can help warm up your muscles and promote good circulation, warding off the neuropathy caused by colder temperatures. Try gentle movement exercises as yoga, walking, elliptical, and lightweight training. Even a light swim in a heated pool could help your body limber and ease away muscle tension. So I went ahead and looked up some more information on different websites because that website only gave me 4 tips to give you. But let me read from this website here. So maybe there's some lifestyle tips or lifestyle choices that you need to make. Test your blood regularly to keep track of your levels. Maintaining good blood sugar levels protects the nerves throughout your body. Keep dry and warm with layers and quality cold weather gear, especially gloves and socks, and always wear a hat. Try to quit smoking. Cigarette smoking can slow circulation and is especially harmful to people with diabetes, increasing the risk of serious complications such as neuropathies. Next, don't give up on exercising in the cold weather. Exercise helps you maintain blood sugar levels and keeps your weight down, and can also keep you warm while improving overall blood circulation. Stay on track with healthy, balanced diets. Don't let the winter holidays be an excuse to overeat. Maintaining a healthy weight is important all year round. One thing that I was always told is to make sure that you monitor your feet at all times. Have someone else take a look at your feet and see if you have any issues. If you can't feel your feet because of nerve damage, you may not notice a cut, blister, or sore, which can lead to infection. So here's some pain medication options. Managing your neuropathy symptoms can mean greatly improving your quality of life. It can also mean more restful nights, as pain and tingling can interfere with sleep. Symptom relief medications include over-the-counter pain medications such as ibuprofen. Antidepressants can sometimes be used even in the absence of depression. The dose used to treat neuropathy is lower than the dose used by depression. Some anti-seizure medications such as gabapentin and pregabalin, which is Lyrica. Topical treatments such as capsaicin cream and lidocaine patches. So I gathered up a whole bunch of different information from different websites. So I could be overlapping and saying the same thing, but there's also some of the things on different websites that are a little different and may have more information than the others do. So that's why I'm reading everything that you can that I come across. So here's another website. And some, like I said, some of these things are going to be repeat of previous ones I just spoke about. But cold weather poses special challenges for people affected by neuropathy. Prolonged exposure to the cold causes the body to slow blood circulation to the hands and feet in an effort to preserve the body's core temperature. The reduced blood flow can intensify neuropathy symptoms and potentially cause further damage to already affected peripheral nerves. This is a special concern to those who experience their neuropathy pain as a numbness or tingling sensation. Their ability to measure the effects of the cold is compromised, since they already experience those physical warning signals that would otherwise indicate a need to get warmer clothing. So here's some tips from this website to lessen the pain and lower your risk of further nerve damage. Wear warm and dry clothing in cold weather. Protect your hands and feet by wearing thick socks, thick mittens, or gloves. Take intermittent breaks from the cold to reduce your exposure to extreme temperatures. Limit or avoid caffeine before outing, as it can temporarily cause blood vessels to narrow. Do not smoke, as cigarette smoke can slow circulation. Limit alcohol use, since excessive consumption can lead to vitamin deficiency, which can, in turn, damage peripheral nerves. Incorporate exercise into your routine to improve overall circulation. And explore comfort measures like massage or use of flexible splints for support. So I also wanted to touch on the area of warmer weather. Does warmer weather affect chronic pain? While science may not have an exact reason for why pain worsens in the heat, it cannot be ignored. Many patients who suffer from chronic pain report that the change in weather makes the pain worse. Bad weather, such as cold or rainy days, are often associated with pain, but hot and humid summer days are actually worse for chronic pain, which I did not know that. I thought cold was the worst, but let's read up on this. Barometric pressure, also called air pressure, is the weight of the air in the atmosphere. It changes depending on the weather. Low pressure means a storm is imminent, and high pressure indicates a clear day. Medical theories suggest that a drop in pressure means there is an increased amount of pressure on the joints. However, heat and humidity affects inflamed tissues and affects the way joints expand and contract. So heat and common chronic pain conditions. Many chronic pain conditions are affected by the heat and humidity during the summer months. So arthritis. A study shows that nearly 5% older people with arthritis reported hot weather influences to their joint pain. People with inflammatory arthritis experience pain when the temperature changes and humidity increases because it affects the way joint tissue expands and contracts, therefore triggering pain. Headaches and migraines. Temperature changes trigger tension type headaches and migraines. The fluctuation in temperature, humidity, and barometric pressure during warmer months can lead to dehydration, which commonly triggers headaches. Number 3, fibromyalgia. The National Association links weather and fibromyalgia symptoms when the weather is humid. People who suffer from rheumatoid arthritis conditions have temperature sensitivity, meaning any extreme temperature, both hot and cold, can have worsening symptoms and heightened pain. Finally, multiple sclerosis, MS. While pain has not always been a recognized symptom of MS, it plays a huge role with this disease. Anything that raises the body's temperature can worsen MS symptoms. This means a hot summer day can make the pain worse. And it is so common that there is even a name for it, and I'm not sure if I'm pronouncing this right, but it's UHTHOFF. That's UHTHOFF syndrome. However, once a person cools down, the symptoms typically go away. I don't know what is up with me today, but I'm having real issues trying to say words here and speak. So let's go on to our next here. Finally, how to deal with the heat. If you experience pain during the summertime, here are some tips to beat the heat and reduce your pain. Stay indoors. Duh. If the humidity and extreme heat causes flare-ups in your pain, spending time in an air-conditioned area will help regulate your body's temperature. Too much time outside can affect your joints and make your anti-inflammatory medication less effective. Didn't know that. Drink water. Drinking water and staying hydrated to maintain electrolyte levels and fluids is crucial to avoiding pain that comes from dehydration. Wear loose clothing. Wearing linen or light cotton clothing keeps your body cool by allowing it to breathe. Tight clothes or even heavy fabrics that do not allow sweat to evaporate or keep your body cool are things you need to be aware about too. And swim. Swimming is a great way to alleviate joint pain and to cool off in the summer months. Low impact cardio like water exercises are great for those who have arthritis or chronic joint pain. And I am so glad that we just moved into our house, like I talked to you guys about last month, and we do have a swimming pool, so I can't wait until the summer. But again, here we are coming to the winter months, and it's time for me to break out my heater, my portable heater, because like I said, I got to have both running at the same time in order to get that temperature just right. But as you can see, for us that have nerve pain or any type of neurological issue, we have to worry about those things like cold and hot weather because they really affect our way of living. Those are things I hope in my presentation today help you with this podcast episode. So we got about 3 minutes left, and I wanted to talk to you about this new supplement product that I'm going to be taking. I talked to you about it last week. Now, if you remember several episodes back, I started taking a Nerve Renew product. That's what it's called, Nerve Renew. And I posted that on the Facebook page, but this time I'm going to be taking a product called Nuterna. It's a maximum strength neuropathy support formula. It has 18 herbs, vitamins, and minerals, including 600 milligrams of alpha lipoic acid. Now on the bottle, this one says to go ahead and take that they recommend 2 capsules for the first 3 to 5 days, and then you can move up to the full dose of 4 capsules a day. Now, I take so many different kinds of medications. I really am careful with what I'm adding to my regimen. And on this product right here, I'm only going to stick to the 2. Now, to be fair, I might not be getting the full dose and it might not help me the best. But, I'm going to run with the 2 capsules first because there's only 120 capsules here. So that's going to give me a month to take these medications, or this supplement. So I'm going to try that first and see where it goes, and hopefully it works out. But like I've said before too, I showed these to my pain doctor, and all he says is, what this is just a bottle of stuff you don't need. So I mean, he says it's stuff that you can just go buy over the counter separately, and it'll probably be cheaper than what I bought that bottle for right there. Now this one here is only $39.97. It's $40. I bought it on Amazon because I didn't want to join the club. And also make sure that when you're clicking on Amazon that you don't click the club, because they also have it on there. Just buy the one supplement so you can try it out first for yourself. Because, we know when you sign up for those clubs, sometimes it can be hard to get out of them. And to get your refund. So it's better just to try it first. Yeah, sure, it may cost you a few more bucks, but that's not going to matter, just as long as you know it's going to work for you. Now, let me give you a real quick rundown on this product. It is listed on very many different websites to be the number 1 product for this issue for neuropathy, but let me read it real quick. Neuropathy support formula is a supplement designed to allow individuals who are suffering from neuropathic pain to lead normal lives. Not only does this product act to decrease or eliminate feelings of numbness, burning pain, and the all too common pins and needles effect of diabetic nerve pain, it works to support optimal nerve health as well as promote healthy blood sugar levels. I don't know about that, but manufactured using a unique combination of 18 ingredients, which are listed on this website, which I'll make sure that you get a copy of this. The product works by allowing available nutrients to reach body tissues at a cellular level. And it says that this product here, Nutrina, is also the only support we found with the recommended 600 milligrams of the ALA, which are the alpha lipoic acid daily dose. One thing I do want to let my listeners know that, a lot of people say, can neuropathy be cured? And they're making that statement here with this supplement. And I have not found anything where I have looked on websites so far. By doing this podcast, I have not seen where anybody has a cure for it. And that's just the searching that I've done. If you guys have found something that, is said to be, is going to be a product that's going to cure neuropathy, pass it on, let me know, because I surely would like to know if there is one. But from what I heard and what I've seen, nerve pain, it's hard to re-heal from that. I mean, usually it's a progression and it doesn't come back from there. I mean, if these products are out there just to give us some relief, then that's great. But, I just don't know about the can neuropathy be cured. When you get, also one thing I did want to mention is when you get these products, if you look on the ingredients, you'll see that they all pretty much use the same ingredient, with the turmeric, the Chinese skullcap, oak straw, passion flower. They all come up with the same formula that I've seen so far. But this one's supposed to say that the alpha lipoic acid 600 milligrams is both water and fat soluble, an effective component that supports healthy nerve cells. It is very effective in the correct dosage of 600 milligrams. Well, if that's the case, I'm not going to start off that way, but I will work myself up to that and see what happens, and I'll go from there. Well, I've ran over a little time extra, but I just wanted to let you know and give you all the details on that product. I'll be starting today, Monday, and I'll be using it for a whole month. But if I start using more than the 2 capsules that I said I was going to use, then it's probably going to be a shorter amount of time. But during that time, if there's been any changes or effects to my body, I will surely let you guys know. So you can see what kind of reaction I'm having with the product. But other than that, I hope this episode helped you in some way, especially with the weather changes coming up, and maybe this neuropathy supplement may be something that works for you too. Well, until next Monday, I want you guys to get out, visit family members. Don't stay at home watching TV. Get some exercise, even if it's around your home. Read a book. That's what I've been doing lately. Is I ordered about 5 books, and that's all I've been doing is reading them. So, it's always good to change up your routine, so that way you can think about those things instead of thinking about your pain that you have all the time. All right. Again, I will talk to you next Monday. As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode, plus others, are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.